In today's rapidly evolving world, digital health innovations are transforming how we deliver and access healthcare, from telemedicine and artificial intelligence-driven diagnostics to mobile health applications and electronic health records. These technologies are helping to bridge gaps in healthcare accessibility, improve disease surveillance, and enhance service delivery. The COVID-19 pandemic accelerated the adoption of digital health solutions, showing us that technology is not just an option, it is a necessity for a resilient healthcare system in Africa. Despite this advancement, Africa still faces significant barriers to fully leveraging digital health, including infrastructure limitations, digital literacy gaps, weak regulatory frameworks, and data security concerns. So now the question is, how can we overcome these challenges and scale digital health solutions for long-term impact? And to help us navigate this conversation, we are privileged to have a panel of distinguished speakers who bring deep insights and real-world experience in digital health innovation. They will help us to explore the opportunities, the challenges, and policy pathways needed to ensure digital health becomes an integral part of Africa's health system. But before we begin, here are a few guidelines. We encourage participation. Therefore, we kindly request you drop your thoughts in the chat box, wherever you're joining from, and your questions in the Q&A box as we go along. For your information, this webinar is being recorded for future reference, and it will be uploaded on our YouTube channel at getafrica.org. Get Africa, rather. So now, on to our first speaker. It's my pleasure to introduce our very first speaker for today's webinar, Dr. Amit Chakra. Apologies if I pronounced that wrongly. He is the Executive Chairman at Africa Health Business, YPO Gold, Kenya. Dr. Amit is a visionary entrepreneur and an industry captain. Dr. Amit has been a groundbreaking pioneer in the integration of private sector within the health system in Africa. He actively supports government, corporate health organizations, and development partners to foster effective public-private partnership initiatives towards improved health outcomes. He is the Executive Chairman of Africa Health Business, President of Africa Health Federation, and the Chairman of Kenya Healthcare Federation, and also currently serves as a Director with UniaDX and Danima Limited, as an active member of several institutions, including international business groups at YPO Gold, at Nairobi chapter. He also chairs the University of Nairobi Alumni Medical Chapter and serves as an advisor to Asia African Investing and Consulting Limited. He founded the Avenue Healthcare, a Kenya-based integrated private health service provider in 1995, which led him to receive the Best Male Entrepreneur of the Year, which was awarded by Rotary International in 1999. He also won the Best CEO Award by Titans Global in the Business and Professional Service category in 2017, and proudly received the Chairman's Award by Kenya Medical Association in 2004. Africa Health Business is an Africa health consultancy, advisory, and investment firm that aims to improve access to quality, affordable healthcare in Africa. Dr. Amit will be speaking on scaling digital health initiatives in Africa, policy recommendations, and investment strategies. Dr. Amit, thank you very much for accepting to be one of our speakers. The floor is now yours.
Thank you to the organizers. Thank you, Faith. And thank you, everyone, for giving us your time to discuss this important topic. I'd like to discuss a few items and areas of scaling up digital health initiatives in Africa. As you all know, digital health is a great promise, and it's something that we are banking on to change the health indicators and overall health in Africa. In fact, so much so that little did we know that the third largest subsector where there'll be high investments in health is on digital health innovations and solutions. The first, as you know, still remains on the supply chain, pharmaceutical, manufacturing, distribution. And the second high investments that we see happening in Africa are around health services. So digital health, in fact, since COVID, has had the largest deals closed because we see a need for bridging the health divide in Africa through digital solutions. Of course, there will be challenges, and it's this presentation that I've prepared to share what policy recommendations and investment strategies could be adopted and what kind of challenges we face. We're based in Nairobi, but we work around 39 countries across Africa and partner with governments, development agencies, and industry leaders and captains to carry out business intelligence. We involve deeply in capacity building. We've designed quite a few platforms in digital health and now implementing them. One recent one you might all know is the apex body known as the Africa Digital Health Network, together with Africa CDC and very many smart players who continuously are trying to make the digital health architecture robust so that countries can adopt appropriate systems. We are involved in stakeholder convening, so I'm delighted to meet the GET team here. And we are actively involved in investments as well as high level networking. Jumping onto the topic for which we've all gathered here today, let me explain a little bit of the status. There is no doubt that the mobile phones and the smartphones will create the largest foundation where we'll be able to make more health. We'll be able to produce more health with less funding if we use the mobile phones appropriately. And this means having smartphones will enable lots and lots of citizens to get information about their health, access health, book health, and get the right quality of healthcare that is required. And South Africa, Nigeria, and Kenya have higher smartphone penetrations. Power is always a concern, and lack of power has been a challenge for us for several years. Urban areas, of course, are doing better than rural areas, and the technology of solar is becoming even more affordable. And hopefully, we can bridge that gap, and power will be necessary for us to deploy effective health solutions. Let's come to the challenging part, the internet penetration. The cost of data still remains extremely high. And you can see from the countries that you are all from, data remains a concern. So, internet penetration, making data available, making it easily available to lots and lots of people will be a critical foundation. So, mobile, electricity, and internet is critical. The emerging trends that we have seen, and already there are excellent models that we see on the continent that are stretching the healthcare practice to wider population. The adoption of mobile phone, as I mentioned to you, is a huge boon for us. And you can see the numbers on your screen. They're heavy. So mHealth solutions and SMS, SSD codes, USSD codes, mobile apps will become very good. It'll become so good that you'll be able to monitor health. You'll be able to place reminders. You'll be able to push information back and forth. And hopefully, we can even start having less cost for you to see the doctor. If you don't need to go to a bank to bank, you don't need to go to a shop to shop, you don't need to go to a health facility for health. And that's what we want to stretch. And that through telehealth and telemedicine could be great. Another trend is the AI. AI is going to embed quality, and that will change great amount of community healthcare. AI is going to make things so much easier, so much quicker, so much faster that in fact, not doctors and nurses, are going to be replaced by AI, but doctors and nurses not using AI are going to be replaced by those who do. The discussions, in fact, have gone so far that if a doctor does not use AI to augment the diagnosis of a patient, he might be breaking the law. And there will be litigation cases because you want to give top quality healthcare to everyone, and AI is going to be a winner. And AI helps AI. One of the challenge we'll have is workforce. We can't have enough workforce being trained in Africa to the kind of population that we have. So with digital platforms, our multiplier effect will be significant. So we may be able to graduate and train more health workforce than we currently do through conventional methods of classroom teaching. The fourth emerging trend is the health records. There are still millions of people who use books, cards, and physical files to look at what the past health records have been. There are very few on the continent that have an electronic health record that looks at all your past visits. And that needs to change, and it'll give us more predictability to the national health systems on developing right strategies. So, to get the right strategies, you need the right policies. And if the policies are great, you have an enabling environment. So, countries that have an enabling environment in Africa will start racing towards better health, adopting digital solutions. Clear policy and regulatory frameworks requires leadership in the Ministry of Health as a steward to make the entire landscape to be easy in which to adopt innovation. The second one is national and regional levels. We need health, digital health strategies, which allows you to adopt new technologies and new strategies in line with the national priorities. Many countries already have the Ministry of ICT, and I hope we will be inviting those ministries in such discussions because the ICT ministry and the finance ministry must be in the forefront of the discussion to allow the structures to be strong and allocation of funds so that the healthcare facilities are all very well equipped with the ICT infrastructure and trained so that the workers in these health facilities are able to adopt this new technology even more quickly. The fourth one is that for data privacy and security, we will need to adopt recognized standards. There is always a scare about so much data about patients on a healthcare system, and national security always raises eyebrows about how this data is safe and secure, what else can be done about the data, not only for the government but also for the patient level. How easily will people access this data? So that needs to be given a serious attention, and puts we need standards that recognize the privacy of the patient. The cost of laying down technology is high. Buying software, hardware, and training does have a huge number. And it's very critical that both public and private work together on this, since private sector is a great leader. It's in the forefront of bringing the right technologies that governments can use, but it needs to provide a fit for purpose architecture, and it needs to be affordable within the budgets or domestic resources that are available. And you could build it in a modeled layer, phased level, rather than having an entire system built which you can't afford. You can actually have a very well integrated phased approach of building your digital health superhighway. Um, Also, it's very important to create sustainable financing models, because if you don't do that from the beginning, you will find yourself probably wasting half the funds if you can't complete a project. What's the use in doing half a project or a quarter of a project and it doesn't help anybody in the healthcare system? So it's important to know what's the total cost, how you start, who else is going to, so you have an end-to-end solution when you start these digital projects and digital solutions in a country that are of massive scale. Then there is the capacity building. New courses will come out and the training of health workforce. We should start training students in our academia for courses that we have never known about. So the new digital health technicians will become a new cadre of staff. You will have AI health technicians, and they will be specialists who then will transform. This is a little different from having, say, a hemodialysis nurse or an oncology or an intervention cardiologist. You must have the new age health technicians that are digitally embedded into new programs. And I hope most of our colleges will start offering this as a diploma and a degree course because they will be central to the ministries of health on the new national health strategies. Let's talk about investment strategies where we have got ideas around having venture capitals, because one of my asks by the organizers was to talk and explain the different innovative financing models. There are impact bonds, and we need to really seriously think of digital health impact bond. We can talk about the health bonds. We've often seen that infrastructure bonds are doing very well in the countries where the road is laid out or the bridge is laid out, and it eventually, in the long term, helps in prosperity and economic growth. We need to now try the health bonds where you have a healthy population that comes onto the employment market and makes strong decisions and brings the country up in its growth and economic curve. Social impact bonds, there are many funds that look at doing good rather than just having a return. And if we design them cleverly, we could get alternative sources of funding that will sort of replace the fading donor model that we are all facing. So for a long time, Africa has been relying on other people's money, and we now need to use our own money for our own health. And this is where blended finance will come in, how private public partnerships can be more effective through a win-win model of a contractual agreement. Let's not forget the public market investments that have been successful in some countries. And finally, crowdfunding. As you all know, when you've attended many organizations or events where you've had to either donate or give a bit of funding, diaspora funding for African healthcare is a significant untapped model of funding. And even if we give small amounts like $1 or two or three, that crowdfunding can build up a nice pot for even vaccinations or family planning. This is where I thought I would like to stop and give you more like an overview. I'm happy to, take questions after all the presentations are over. Feel free to write your questions on the chat box or even email. Faith will collate them and I will respond offline when I will have a chance to connect with the organizers again. I know the other presenters following this topic will give you deep insights into what they will have to say. Thank you for your time. Unfortunately, I'll have to drop off because of another engagement, Faith, but I do thank the organizers for giving me this opportunity. Thank you.
Thank you so much, Dr. Amit, for that insightful presentation. We really appreciate your time despite your tight schedule. Your points and recommendations, your recommendation and strategies rather, to scaling up digital health innovatives are truly thought-provoking. And here, a few takeaway from his talk. He gave some policy recommendations, which include ensuring clear policy and regulatory framework, developing a clear digital health strategy, strengthening of ICT structures, private-public partnership, and so many more. He also talked briefly on investment strategies, such as public-private partnership, venture capital investment. We truly, truly appreciate this. The slides of the speakers will be shared after the presentation, after the webinar session, after we have permission from the speakers. Thank you so much. And now to our audience, we would like to hear from you. Kindly drop your questions and reflections in the Q&A box, and we'll address them during our discussion. So right now we have our next speaker for the day, which is Dr. Steve Ollis. He is an independent consultant. Dr. Steve Ollis is a digital health expert with over 25 years of experience in IT consulting, health information system, and project management. Most recently, he was a senior digital transformation advisor and project director for the country health information systems and data use program. In this role, he has been instrumental in promoting digital health solutions to improve healthcare outcomes. Prior to his current position, he worked as the project director for USAID Fund CHISU project as John Snow, INC. He also had roles as the JCI team lead for the PMI Measures Malaria and Measure Evaluation Project and senior digital health advisor for USAID at Maternal and Child Survival Program. Before joining GSI, he served as the COO of the True International, where he developed digital health solutions to improve the quality of care provided by frontline health workers. He is also an adjunct faculty member at Georgetown University School of Health. Steve's expertise lie in digital health, health information system, and data use. He has worked extensively in promoting the use of digital technologies to improve healthcare outcomes, particularly in low and middle income countries. He will be speaking on the role of digital health technologies in enhancing healthcare accessibility, quality, and efficiency in Africa. Dr. Steve, thank you so much for honoring our invitation. Over to you.
Great. Thank you so much for the introduction and for the opportunity to be here. Again, good morning, good afternoon, good evening to everyone. I'm looking forward to sharing my thoughts and to being a part of the Q&A. Let me go ahead and share my slides here while I'm talking, see if we can do this. Here we go. Okay, just confirming that you can see my slides.
Yes, we can.
Great. Okay, well, let's go ahead and get going then. So again, my name is Steve Ollis, and I'll be talking about the role of digital health technologies in really enhancing the healthcare, looking at accessibility, quality, and efficiency in Africa. So let's go ahead and start this. So I think a few things I wanted to cover, because there is still, digital health is a very exciting field and it means a lot of different things. So I wanted to start with, what do we mean by digital health? Is it, for some people, it's mHealth, mobile health, short codes and sending SMS messages. For others, when they think about digital health, they're thinking about electronic medical records. And that is everything that is digital health. And then, of course, we can't go have any conversation without talking about artificial intelligence. And is just artificial intelligence in health, is that digital health? And the answer, of course, is that it's all of these things and more. So digital health is simply the application of information communication technology and data to support informed decision-making by individuals, the health workforce, and health systems to strengthen the way that healthcare and health services are being provided. So when we talk about digital health, again, it's important to make sure that we have a full understanding of the field. So I think a good resource to explain this is from WHO, the World Health Organization, again, the classification of digital interventions, services, and applications in health, which you can get online, but basically divides this world of digital health up into 4 areas. So the first is around the digital health interventions for individuals, for people who are in need of care or need information. The second is around providers. So those who are actually providing care, what are some of those digital interventions that support health workers in doing the work that they do? The third area is now looking a little bit more at the system and looking at the management, the managers of digital health systems and of health systems and the support personnel. So what are some of those interventions that can support them? And then the fourth is really getting into the data. So much data is being collected, generated every day, every minute, every second, and really looking at what are some of those digital tools to collect, manage, and analyze that information. And this is where artificial intelligence really comes in. So I also wanted to make sure that we were clear on what we were talking about with accessibility, quality, and efficiency. And I think a good framework to be able to use is to look back at the health system's challenges. So we have health systems that are trying to do something. And these health systems are not always working as effectively as they could. And so we are then developing digital health tools to try to address some of these challenges. We're not developing digital health tools simply for the sake of it. This is not just to have technology proliferate, but because we're trying to address very specific challenges. So again, this is from the WHO classifications, looking at the health system's challenges around information, availability of supplies, health workers, commodities, quality, acceptability, utilization, efficiency, cost, accountability, and equity. So as we think about digital health, and as we think about any solution or intervention that is being proposed, we need to be very clear about, well, this sounds very exciting. This is really interesting, but what is it we are trying to achieve? Which of these challenges are we trying to actually address? So I think if we go to the next slide here, we can see the quality area, and we can drill down a little bit here. So we're trying to improve quality. We're looking at trying to address maybe the poor experience that a client has at a health facility, low quality of commodities, inadequate supportive supervision, inadequate adherence to clinical guidelines, or inadequate identification and management of risks. If these things are not being addressed, we're going to have low quality. When you look about efficiency, we can be talking about a number of different areas. Inadequate workflow management, poor referrals or planning, delayed provision of care, inadequate access to transportation and services, and really, very importantly, this burden of manual processes. There's a lot of paperwork that's involved in healthcare, and we're trying to address that as well. We talk about accessibility. There isn't a box explicitly here just for accessibility, but I think it cuts across a few areas. So one is really looking at utilization, of making sure that the services are accessible to the population. And that can be because they don't know that these services exist. They don't understand why they need these services, or something as simple as the geographic inaccessibility. I think we're all very familiar with people who are having to walk 2 kilometers, 5 kilometers, 10 kilometers, 15 kilometers to receive healthcare across very challenging terrain. Sometimes terrain that has been made even more inaccessible by some of the factors around climate change. So another area that I think this shows up is in the equity side of making sure that the health systems can be providing healthcare to everyone, regardless of their background, regardless of their geography. So I think when we look at these 4 areas, I think this really maps back nicely to those areas of quality, efficiency, and accessibility. So when we talk about accessibility, and again, this is just a brief sampling, there are so many interventions and so many things that are being done to address these issues. But we can talk about things like personalized care, where people can receive individualized care using mobile devices without having to and interact with clients, get the information they need, interacting with health workers at the privacy of their own home. They can get door-to-door service. There can be outreach. There can be community health workers who are providing services that are powered by digital devices to be able to make services much more accessible by going out to them. And then, of course, telemedicine. Being able to actually interact with a medical specialist without having to physically be present, taking advantage of that ICT infrastructure that Dr. Thakur mentioned. So just a few examples here again around accessibility. And I know that we have some folks here from Kenya in the call. So one of the major accomplishments in the last few years and big achievements here in Kenya have been the rollout of the electronic community health information system. This has been an effort where there were a few different small-scale community health information systems that had been rolled out, and in the last year, then the system went national. So it went from a small number of users to over 100,000 community health workers using digital tools to provide these services. So you can see they're enrolling households, they're providing service to mothers and children, they're referring clients, they're managing commodities, and this then information rolls up to the subnational level where they can receive supportive supervision, there can be quality checks of the data, and then at the national level, this is being integrated into the Kenya National Digital Superhighway. So this is an example, again, of addressing the accessibility issue by having community health workers using digital tools to go door to door to provide those services. Another approach to the accessibility challenge, and I've seen some folks from Nigeria on the call as well, so I knew I had to mention someone from Nigeria. So if we look at mDoc, this is really a service where people are able to access the information using digital devices. So there are virtual coaches and digital nudges through some of their tools. People can actually look through a digital directory of health services and providers using digital tools. This is also complemented by face-to-face, in-person community ambassadors that can support the individual in their health journey. And then also they're leveraging technology to provide distance learning, electronic teleeducation of providers and patients through the mDoc Quality Network. So when we talk about quality, again, so many aspects here to try to address. Faith had mentioned that I worked at Dtree, so my heart still lies with the decision support tools, which is where I did quite a lot of my early work, really working on step-by-step decision guides for health workers at every level of the health system to really guide them step-by-step on what are the things they should be looking for, what are the questions they should ask, and then most critically, what should they do, what kind of counseling should they provide to the clients based on what's been seen. So really leveraging decision support algorithms to make sure that the quality of care is the same regardless of where a client is being seen. The ability to access longitudinal records through an electronic medical record and other tools to be able to see, I have the background of this client here. I can see that their weight has increased or decreased or blood pressure has been high for some period over time. Being able to access that longitudinal history of that individual client can help me improve care. And then a third area, and of course I had to mention AI in here somewhere, we're seeing quite a lot of use in artificial intelligence to actually read images and to be able to flag abnormalities to try to address some of the shortage of qualified staff to read these. So I'll go through just a few examples here as well. One of the examples is from Cure AI, using image screening and AI to flag irregularities in images in a number of cases, but particularly around tuberculosis. This is being used quite a bit in Africa, but also globally, and really then does not, again, replace the specialist, but really helps to go through this huge volume of images and flag those that need to be, there's some sort of abnormality that should be reviewed by a specialist, really saving a huge amount of time and money and making those specialists so much more efficient by focusing their attention on some of those that have the abnormalities and less of their time on those that are normal. On the decision support side, there's a tool called Spice from Medtronic Labs that has been rolled out. This is being used by community health workers as well as facility-based workers to, again, provide that step-by-step guide to health workers on what it is they should be doing across a variety of services, whether this is for non-communicable diseases, or other health areas, and provide prompts to the health workers as well as to the clients themselves, based on the information that's been provided on what should happen next, what types of follow-up should be done, what types of prescriptions. And again, this is sitting on top of an electronic medical record. So it's a guide based on what's happening today, as well as what's been happening in the past. Now talking about efficiency, and I mentioned this paper records issue. This is a snapshot from the look of the binders and the booklets and the registers that health workers are asked to fill out, and community health workers are asked to fill out and carry with them. So when we're talking about efficiencies, some of the areas that I'll talk about are really efficiencies in reporting, moving away from this paper-based reporting and going around and manually collecting and tallying information, and also efficiencies in how we are distributing resources, doing this based on the data rather than on gut feel. So one of the very popular solutions to address this reporting issue is DHIS2, which many countries in Africa have adopted as their national health management information system, as well as lots of many other uses. But really looking at the data collection, the reporting, and analysis. So taking this from what had been very manual processes, very slow processes, to where data can be collected at the individual level, rolled up and analyzed and available for health systems supervisors and national level managers to be able to make decisions about what intervention should be in place and how to allocate those resources. So I've mentioned just a few innovations, and there are so many of them. One of the good resources to try to keep on top of this is the WHO Digital Health Atlas, which is being hosted on Implementome. So this is a good place to look for more interventions. And of course, this is not a complete listing, but it is a good, very good starting point. And you can drill down by country and type of intervention if you're interested in learning more. And so I think I've touched on these few areas, and so many tools. And so I wanted just to reflect a bit, as Dr. Thakur did, on where have we been? And so we have a little bit of a sense, this didn't just happen. Initially, as the mobile phones became quite prevalent, we were developing interventions using SMS and USSD. Then the smartphone revolution came. The smartphones were introduced, and then they became very inexpensive. We then had pilotitis, where we had many, too many perhaps, digital health interventions, which were springing up everywhere, often without coordination. Then as a few winners started to emerge from those digital health applications, we went to a level of scaling. So really moving from those 2 health clinics and 10 community health workers to starting to reach some of this national scale that we're talking about. Then we moved to the development of national strategies, as we were finding that, okay, we have all these solutions. Some of them are going to scale. This is fantastic. The infrastructure is improving, although there's still work to be done. We need national strategies and governance mechanisms to ensure that this is moving towards a complete health system and strengthening the system rather than just so many disparate tools. And then, of course, we have artificial intelligence, which is being used, as I mentioned, for image reading, but also for forecasting and so many other things. And so then after that, we don't know what will happen exactly. What technology will emerge next, but it's still interesting, I think, to see where we've been, to see what we can learn from this, as well as think about how we want to apply some of these lessons into the future. So I've talked a lot about the technology, and that's an important component of digital health. But let's put the technology aside for a moment and talk about what is actually needed to be successful. And I know we'll get into this in more detail, but I think often it is too often overlooked, some of these soft components that are really needed to effectively introduce, scale, and sustain digital health interventions. And so one of the big ones is around governance. We have to have a vision and strategy of where we want to go. We have to have an understanding of an overall framework in which we're going to do this. We have to know how we are going to adopt new technologies, how we're going to increase the availability of innovators and make sure that they have clear guidelines on how to come in and play in the public and private systems. This issue of interoperability, yes, there's a technology component here, but quite a lot of it is really around the political will of getting people to make sure that their systems will talk to each other, take the time to do this, take the time to define the standards, and make sure that the systems can actually talk to each other. Because if we're not doing this, if the systems cannot talk to each other, then we're going to increase the burden of on the health workers who already have too much to do by making them enter in data multiple times into multiple systems. We're going to have poor quality of care because the health workers and the clients may be getting different information because the systems don't have the same information. So this interoperability component is really critical, particularly as the technology has gotten cheaper. So we've talked about the governance, we've talked about the tools, we've talked about interoperability. Now, what happens if all of the data that is being collected is not being used? We assume that when data is collected, when a health worker asks me information and writes it down, that that information is going to be used to provide care to me today, tomorrow, going to be used to inform health systems planners. But actually, the percentage of health data that is routinely used compared to what is collected is actually very small. So if we really want to see all of these improvements, we need to really improve the data use. We need to make sure that we're only collecting data that's going to be used. We need to make sure that data is of high quality, and we need to make sure that that data is actually going to be used by as many people as appropriate to make decisions. Another component is political will. The government needs to be sure that they can push this, and there will be some bumps along the way, but that political leaders are seeing this as a way to improve the society that they've been elected to serve. So political will to keep this moving and to enforce standards and to keep a thriving ecosystem is very important. Another piece, as I mentioned, is we talk about the digital tools, but the paper. We have to move away from the paper. This has to be done. Otherwise, we're not only asking health workers to put data into multiple systems, but to also report into paper, which may be required for regulatory components. Across all of this, we also need change management. We need to understand what are the barriers for people to adapt tools. We need to understand what are the barriers for people to not use data or to enter in bad data. So we need to really adopt a behavioral science approach in all aspects of what we are doing in digital health to really improve their uptake. So the change management here is around the people side, not just in the IT change management. How do we manage changes to our IT systems? And then finally, there's been a big focus on cost. How much does it cost to deploy a system? How much does it cost to do this? And we need to change our thinking to move from cost to thinking about return on investment. What is the cost of status quo? And what will it? Yes, there is a cost to doing things, but viewing this as an investment, that if we invest in this approach, then we will receive some sort of returns, whether it be in cost savings or it be in improved quality of care and improved health outcomes. So just a few thoughts. I know we will dive into these in more detail. So with that, I'll say thank you very much. I look forward to any questions you may have, and I look forward to hearing from the speakers on the rest of the presentation. Thank you.
Thank you very much, Dr. Steve, for those valuable insights. Your points on digital health accessibility are truly inspiring and thought-provoking. So here are some points I gathered. So you mentioned that digital health is the use of information and communication technologies, computer science, and data to support decision-making, enhance healthcare resilience, and improve the overall wellness. So you also mentioned how we can improve digital health in healthcare. So you mentioned accessibility, which enables telemedicine, personalized care, door-to-door services, as seen in Kenya. And you also mentioned quality, which supports AI-driven diagnostics, electronic medical records, and decision support tools for healthcare providers. You also mentioned efficiency, which improves data collection, reporting, and resource distribution using platforms like DHIS2. And he also talks about the challenges and what we need to do beyond technology. You spoke about governance and policy. You said digital health requires strong policies and frameworks and political commitment to be effective. You also mentioned data-driven decisions. You said the focus should shift from cost concerns to return on investment, that is ROI, in digital health adoption. I also mentioned scaling beyond pilots, that Africa has seen many digital health pilot projects, but true impact comes from nationwide implementation strategies. So putting all this together, you've given us comprehensive strategies and tools on how to enhance healthcare accessibility, equality, and efficiency in Africa. Thank you so much. We truly appreciate your presence. And now back to our participants. Kindly share your thoughts in the chat and please direct your questions to the Q&A box. For those that are just joining, this is the March edition of the GET Webinar Series 2025. And we are discussing on digital health innovations for strengthening health systems in Africa. And our last speaker just now was Dr. Steve Oli, is an independent consultant, and he spoke on the role of digital health technologies in enhancing healthcare accessibility, quality, and efficiency in Africa. So please, if you're just joining, kindly drop your name and location in the chat box so we can acknowledge you. So we are coming to the end of the session and we have our last speaker for the day, Dr. Adeolu Arobundade. He is e-consultant, operational drive physician, and emergency trauma care doctor. He is the current president of the Social for Telemedicine and e-health in Nigeria, a country representative body of the International Society for Telemedicine and e-health. He holds a master's degree in global e-health from the University of Edinburgh and serves on many digital health committees, both at the national and subnational levels. He is a representative member of Nigeria's delegation to the International Organization for Standards Technical Committee on Health Informatics and the local National Mirror Committee of ISO TC 215. He has been a part of the crafting of many national and state digital health strategy and policy documents, including the first digital health strategy and policy document in Nigeria, the FCT Digital Health Strategy document in 2012. He is a member of the Lagos State Digital Health Core Strategy Team. Dr. Adeolu Arobundade is a trauma room physician and medical director of the Lagos State Accident and Emergency Center. He is also a dive medical professional trained from the University of Stellenbosch in South Africa. He holds a health management certificate from the Enterprise Development Center of the Pan-Atlantic University and a multiple leadership and a management certificate from the University of Washington. He has been a part of many national digital health projects, including the development of the National Digital Health Strategy Framework and policy development. You'll be sharing insights on the barriers and enablers of successful implementation of digital health solutions in Africa. Dr. Arobundade, thank you for accepting our invite. We truly appreciate you. The stage is yours. Thank you.
Thank you very much once again. Good morning, everybody. Thank you, Dr. Steve and Dr. Amit for your wonderful presentations. I'm going to try and share my slides now. Please let me know once you're able to see it.
Yes, we
All right,
can see
I hope we can see. All right, beautiful, beautiful. Again, my topic of presentation is barriers and enablers for the successful implementation of digital health solutions in Africa. And I'm going to start by just underscoring we have had the importance of digital health as a tool for improving healthcare access, improving outcomes on the continent of Africa. I will start by, referring to the Bellagio call to action, the WHO Global Health Evaluation meeting I held in September 2011. It's basically, underscored the importance of, being smart about applying digital health as a tool, because the potential issue is that we may end up focusing on technology rather than the health outcomes that we are looking for. And so the Bellagio call to action, one of the things it says is if used improperly, e-health may divert valuable resources and even cause harm, and implementation must be guided by evidence. So we don't start from technology, we actually start from the challenges the health issues that we want to address, and then use affordable, sustainable solutions, digital health tools to meet the needs. And this has been underscored by the previous speakers, Dr. Amit and indeed Dr. Steve. So I'll talk about what are some of the common barriers that we experience in digital health. And the first one that I'll speak about is the issue of infrastructure and connectivity. We all know that Africa has been burdened by poor infrastructural development. One of the very important one that has impact on almost every field of every space of endeavor in Africa is the area of poor power supply, poor electricity supply. And these are significant impacts on Africa and even the evolution of other endeavors, including the implementation of digital health. And of course, if power is poor, and then it means that technologies like the general telecommunications will also become poor. So, for example, in Nigeria, I know that many telecoms organizations have to depend on diesel power generators to run their mast and their infrastructures. This makes access very low. And then if you look again, you see that Africa has poor internet access. In fact, I have a graph there from the International Telecommunications Union, and you can see the rest of the world compared to Africa. While percentage of individuals using the internet by region for 2023 around the world was noted to be 67%. In Africa, the lowest from around the world turns out to be 37%. So poor infrastructural access plays significant role in digital health solution evolution in Africa. Another one that, another data that I found very interesting is the fact that even as bad as it is across the continent, you will find that we have been polarized into rural and urban areas. And then that also widens the gap. In the same reporting, I mean, the same study by International Telecommunications Union, you'll find that in the urban areas, percentage of individuals using the internet in the urban areas is averagely about 57%. But when you go to the rural area, it's just about a quarter of that population that has access to the internet. So this underscores the importance and the fact that we need to, as a barrier to implementing solutions. Solutions must also be able to, overcome these barriers. Then the next thing I'll talk about again is the affordability and equity. The cost of technology continues to rise, and if a telecommunication organization has to power equipment using diesel generators, definitely they're going to have to pass the cost of that to their subscribers, to their end users. And therefore, the cost of access to some of these technologies continues to rise as we find it, I mean, as the access as infrastructure that they are based upon also becomes, harder to maintain. So if you see that the gross national income per capita around the world as a percentage cost of mobile broadband, as a percentage of the gross national income per capita, also turns out to be the highest in Africa. Around the world for 2023, it was 1.3%. The cost of mobile data as a percentage of the gross national income per capita. But in Africa, the cost goes as high as 4.5%, which is a significant cost to the people living in Africa. And again, if you look at the cost, that cost also continues to drive a divide between the lower income earners in Africa and then the middle and upper income earners. And so also you see the similar effects among the people that dwell in the rural areas and the people that are in the urban areas. So we continue to widen the digital divide. And if digital health solutions are supposed to make universal health care coverage universal health more accessible to the population, then there's a potential to create a divide if we don't develop solutions that also meet the need in the rural areas and also the less advantaged in the society. So again, another very important factor to consider is policy and regulatory environment. There is largely a lack of clear regulatory framework across the continent. Many governments around the world have not been able to come up with policies that guide the implementation of digital health and the policies that guide the use of data privacy, and protection on the continent. A graph from the WHO Global Health Observatory shows that again, Africa has the lowest, generic privacy legislation, across the continent. So just barely over 40% of African nations have developed any form of privacy legislation or strategic documents or policy to guide the implementation of digital health on the continent. And then I'll talk about this. It doesn't appear to be very clear on my screen. I hope you're able to see it. I talked about infrastructure, and there's something called the ICT environment for digital health. And then when we talk about policies and regulatory framework, we call that the enabling environment for digital health. And so if you put the enabling environment, which includes the regulatory framework, the policies that is in place in a particular country or nation, if you put that on the x-axis, and then you put the ICT or the infrastructural environment on the y-axis, and then you go from the left to the right as from emerging environment to a fully established environment on the extreme right. And then at the very bottom of the ICT environment, you have emerging ICT environment or infrastructural environment. And at the top, at the pole of it, you have a fully established environment. You will find that Africa appears to be more on the left of the four quadrants. I know that somewhere along the line, Nigeria has been able to manage to move to the scale-up parts, to the scale-up, which means that the ICT environment is becoming gradually established. The enabling environment is also becoming established. But even at that, many of us are still, many states, many countries in the nations in Africa are still trying to find their way, to get to the mainstreaming of digital health solutions. So that continues to be a barrier for implementation of digital health on the continent. And then again, we have skills and capacity. There's poor digital literacy on the continent, and then technical expertise is also poor. Many times you have policymakers do not even have a full understanding of the digital health environment. They don't even understand fully what it entails, and therefore policies that come from such entities will sometimes be flawed if appropriate expertise is not brought to play. And again, the very important, I like to mention the issue of standards and interoperability. I know that Steve also mentioned it. But quickly, I want to note from a study from across the Atlantic and from the US. They found that, Africa, for example, now is we're having the trimodal pattern of diseases. We're beginning to have a rise in what we call the chronic diseases, non-communicable diseases like diabetes, cardiovascular problems, cancers, and the rest of them. These are chronic diseases that require long-term management, sometimes for the lifetime of the patient. Now, this studies found that on the average, for a patient that has multiple chronic diseases, they will require to see, they see about, on the average, about 14 different physicians if they are managing chronic diseases. And in that, they make 37 physician visits every year, filling about 50 prescription sheets. So you see now that a person, as Africa is moving towards non-communicable diseases, we're going to be seeing a lot of this. Patients having to have multiple physician visits, filling multiple prescriptions, doing multiple laboratory investigations. The studies have found that when this is the case, then the patients are exposed to more medical errors. And as a matter of fact, this is not even just on the continent of the Americas, it spans across the world. And another study shows that medical errors continue to increase as the number of physicians or practitioners that the patients see also increases. So for patients that are seeing 4 or more doctors across the world, and you can see it from the graph, you can see from Australia, Canada, France, Germany, Netherlands, United Kingdom, United States, you can see that the number of errors, the medical errors, almost double once they begin to see more than 4 or more doctors. And the basic, simple reason for this was that even though in many of these countries you have digital health solutions, many of these solutions were not interconnected because they are not interoperable. The meaning is that if a patient goes to see a physician, and even though the system is a digital system, the information or the data collected from that encounter cannot be transferred to another physician. That to be subsequently seeing the same patient, and therefore you have the propensity to generate errors. And these are the things that we must avoid if we are to use digital health to successfully meet the health demands in Africa. Very quickly, I'll move to some of the enablers so that we can see some of the things that are currently working for us. Dr. Amit mentioned the place of mobile health technology, and we cannot undermine it. In Nigeria, for example, you have about over 200 million mobile phone subscription. That's almost the whole population. And if you look at the teledensity, it's over 150%, teledensity. So we have a growing phone population, and therefore, you find that an average home on the African continent, an average household has access to a mobile phone. In Nigeria, back in 2002, before the advent of the mobile phone, there were just 100,000 mobile phone lines in Nigeria. And today we have about 200 million phone lines, and that is real access. So if we can take the mobile phone, if you expand that, you find that you have about 20 more mobile phone, more computers than you have hospital beds in Africa. You have about 20 more computers than you have hospital beds. And you have about 200 more mobile phones than you have hospital beds, an average population on the African continent, which means that if we can use the mobile phone to develop or to deliver healthcare, then we can begin to address some of the problems that we have on the continent. And then I saw this very interesting data on social media, and I thought to present it here. It just shows the trail of how long it took certain utilities around the world to attract 50 million users. And you see that the airplane took 68 years to reach 50 million users. Cars took 62 years to reach 50 million users. And then the television set took 22 years. Mobile phones took 12 years. The internet itself took 7 years to reach 50 million years. YouTube took 4 million years to reach 50 million users. And what do you have? An app, a mobile app that runs on our mobile devices took 19 days to reach 50 million users. That's something that we can leverage and use to meet the needs on the African continent. Another enabler that we need to pay a lot of attention to is the youthful and tech-savvy population in Africa. Today, we have young people that are doing fantastic things on the continent. And the ITU Facts and Figures 2024 publication also shows this, that on the African continent, the young people between the ages of 15 and 24, 53% of them have access to the internet, are using the internet actively, compared to 34% of the other population. So we can take advantage significantly of our young population to begin to do a lot of things on the continent. And if you find, you realize that on the continent, the population of young people is beginning to grow. This graph has been morphed out, but it's supposed to show that even in Nigeria, in the last 10 years, the population of the age group 15 to 50 has significantly been on the upward rise. So it's important to understand that we have a youthful and tech-savvy population on the continent. And in recent time, I don't know if you have listened to the news, we have the news of a young Nigerian called Sahid Aziz from the University of Lagos, who's just developed the Yan GPT that has the capacity to use the large language models with Nigerian accents. So it means, and it's open source, which means that multiple entities on the continent can begin to take advantage of it and build on what he has. And then also you may have had in recent times where an African young man called Hamid Ibrahim said they were going to kick the behind of Walt Disney Studios. And then recently, Walt Disney has partnered them to produce a 3D animated movie called Iwaju. So these are the things that young people on the African continent are able to do, and the landscape is littered with young Nigerians like Dr. Ikwemenito doing the Wella Health. We have Dr. Saloko's Uncle Paddy. We have Fumi Adewara's Mobi Health, and all of these solutions are across the continent. We need to take advantage of our youthful and tech-savvy population. And then one other thing that we can use as an enabler is to the leapfrog capacity of the technology. There are so many legacy systems that we can avoid and then jump straight into what works, what is cutting edge, what is sustainable. And you have examples of that in Zipline. And Rwanda Zipline has been able to use that to deliver blood products, to deliver vaccines, valuable vaccines to remote areas of the continent where access will otherwise have been difficult or impossible. And these are the kind of things that we can take advantage of to avoid, reinventing the wheel. And also very, very important is the growing government commitment and policy support. I dare say that on the continent, government around the continent has begun to show more commitment to supporting digital health solutions because they're beginning to see the potential impact that it can have in being efficient and being effective in delivering care. So many governments are beginning to develop different policies, different strategies, and improving the enabling environment.
I've disconnected you first.
All right. So many African governments are beginning to develop national digital health policies like the one we have in Nigeria. In Nigeria, we had the national health ICT strategic framework that was developed in 2015, and it was reviewed again in 2021, and we now have a current one. And we also know that in Nigeria, we now have a national digital health initiative that promises to enshrine digital health in the delivery of health services in Nigeria. In Lagos State, we've recently had a launch of the Lagos State Smart Health information platform that promises to, connect all the healthcare providers across the state and make healthcare delivery through digital means, accessible, support policy development by making data available to policymakers, and also create a platform that AI can be put on, and then we can have better delivery of care on the continent. I think I'll stop at this time. I think I've exhausted the time that I've been allotted, and I'll take questions. Thank you very much.
Thank you so much. Wow, what an insightful session so far. Thank you so much, Dr. Arobindadi, for that insightful presentation. All your points on the physical challenges, the opportunities that shape the future of digital health in Africa are truly thought-provoking, and I love the fact that you used real-life examples, particularly in Nigeria. And here, a few takeaways from your presentation. You mentioned the major barriers to digital health implementation in Africa. We have infrastructure and connectivity, which is limited internet access, unreliable electricity, poor telecommunication networks, which hinder digital health adoption. We also have affordability and equity. So we have the high cost of technology and data, which widens the digital divide, making digital health inaccessible to many due to the socioeconomic status. We have policy and regulation. You mentioned that lack of clear regulatory frameworks and limited government investment slows down digital health integration. You also mentioned the skills and capacity. You said low digital literacy and shortage of technical expertise. They pose challenges in managing digital health systems. Lastly, you also mentioned the standards and interoperability of healthcare system. So this healthcare system are fragmented and the lack of standardized platforms makes data sharing difficult. They also gave us some key enablers for successful digital health in Africa. One of the key enablers are the high mobile penetration. Said increasing smartphone adoption and mobile network coverage create opportunities for mobile health solutions. And you also mentioned the Africa's young entrepreneurial workforce. You said that it is driving the digital innovation in healthcare in Africa. You also mentioned the government's commitment. As growing recognition of national digital health strategies is creating an enabling environment for expansion. So thank you so much for this beautiful point. Right now, we are going to move on to the discussion session. So we deeply appreciate our speakers for sharing their expertise on digital health innovations. Now we'll take some time for the Q&A sessions. If you haven't dropped your question, kindly do that in the Q&A box now as we go into the question. One of the questions we have here is, do our speakers, have they seen real-life examples on digital applications to different conditions? What would be done for NCDs? What are the strategies for epidemic outbreaks? And how about health education for things like immunization? What successes and challenges seen? I would like to rephrase that question. Have you seen real-life examples on digital health applications that has been successfully used for different health conditions? And how can this digital health be leveraged for non-communicable disease, epidemic response, and outbreak management? Additionally, what are the strategies that can be used to enhance health education, such as immunization awareness? And what are the successes and challenges as you have observed? So I would like to address these questions to both our speakers, Dr. Steve and Dr. Arubundade. Thank you.
Sure, happy to go first, or Dr. Adeula. If you'd like to go first, happy to follow.
All right, Steve, you can go ahead.
Sure. Thank you for the question there, and I think a few different questions. I actually was just digging for this. I will drop the link in the chat. There we go. This is a oh, actually, I went to host and panelists. Let me try to get this to everyone. How about now? There we go. Okay, getting that technology to work. I think one of the key points that I wanted to make, and it is really emphasized here, and this is the World Bank Digital and Health report, and really to emphasize that one of the key components that we've seen, we saw this with Ebola, we saw this with COVID, we're going to see this in the future, is that It is very important to, before we build some new tool for the next new thing, the next new problem that comes out, the next epidemic, is really to build a strong ecosystem, a strong infrastructure, and to leverage what's already there. So I think the points that were made, that are being made in this report, really highlight that countries performed very well that already had that strong enabling ecosystem, had some strong digital foundations, and those that did not really struggled. Or again, you had many tools coming out, but they were fragmented and could not share information effectively, and there it was difficult to use data. So that's, I think, just one point in general. So as we talk about NCDs, really looking at, rather than designing a specific solution for NCDs, is to look at what can we leverage, what existing reporting systems, what existing EMRs, what existing decision support tools could we leverage and layer in that NCD work to be able to reach the same populations, draw from their medical history that we may have collected for other purposes to be able to provide care. So on the NCD side, I think that SPICE platform that I mentioned is an important one. Certainly for the epidemics, the outbreaks, the routine use of things like One Health information systems that collect rumors about strange things happening at the community level, whether they be around for the animals or the environment or health. That's a very important thing. Being able to leverage routine reporting tools to be able to see, oh, we're seeing a big increase in something. And again, being able to use that data is probably the most important thing, rather than looking to build something new. On the health education side, again, lots of examples, both for providers as well as for individuals. I think with COVID, WHO put out an app. There's Reach Digital Health in Africa that really leveraged WhatsApp quite a bit. So lots of use of things like WhatsApp or text messaging and chatbots to be able to get information, as well as tools for health providers, really moving away from some of that face-to-face training, excuse me, to be able to deliver initial as well as refresher training through courses on mobile devices. Over to you, Dr. Adeola.
All right, thank you very much. So I'll quickly add there that thank you for the things you shared. I believe Steve shared in the course of his presentation the Digital Health Atlas that also shows some of the solutions that are currently being implemented. We can see that, and we can check that, and you'll find that quite a number of solutions are actually being implemented. One of the ones that excited me, and I think I mentioned it, I don't remember, but I think I mentioned it. There are quite a number of solutions on the continent. And one particular one, because you asked about real life examples, one that I'm aware of that I've seen how it works is the one called OncoPaddy. And this was developed by a radiation oncologist who uses the app to connect cancer patients to physicians and manage their conditions and track their care. So there are handfuls of solutions there and there across the continent, and they're actually making impact. With regards to non-communicable diseases, there are quite a number of things that we have to understand in the care and in the management of these patients. Like I mentioned also, many of these patients are going to be on care for a very long time. One of the critical things in their care is to be able to track their management. They're going to change locations, they're going to change physicians, they're going to get medications. And like I mentioned in my presentation, once a person begins to have more than one chronic disease that they are managing, and there's a latitude, a degree of complexity that comes into their care. For example, the same patient may be seeing an endocrinologist somewhere and a cardiologist in another place. Even if it's in the same facility, in the same hospital, they are seeing different physicians. And the physicians sometimes do not have access to complete data from these patients. And these patients are going to be getting prescriptions, sometimes on a weekly basis, sometimes on a monthly basis, sometimes every 3 months, they have to fill prescriptions. And if these things are not managed appropriately, if this healthcare delivery is not connected, then you will not have an optimized outcome. Even though the patient may be getting better in his cardiac care, he may not be getting as well in his metabolic care. So for NCDs, it's critical to be able to connect them. And that's on one side. On the other side is also patient engagement. The issue of patient engagement is the fact that you need to bring the patients themselves, make them involved in the delivery of their care. And many times this is done by giving them understanding of what they are doing, connect them to anonymous groups of similar, patients that have similar conditions, where they can discuss, where they can share ideas, where they can see what, encourage one another. Another point is to be able to connect them to important information that helps them in the care, the management of their conditions. And also very important is the fact that they may also want to be able to connect their data. These days, we have devices like Fitbits and wearables that are able to collect, track how many steps a person has taken in a day. All of this data can be connected to the patient's electronic health records. And these can be available to advise the physician in the course of their care. Many patients have high blood pressure, for example, are able to monitor their blood pressures in their houses. But the tracking that they do, are they able to make it available to the physicians? People monitor their blood glucose levels in their houses. What if these devices are able to be connected to their electronic health records, and therefore their physicians able to see how they are progressing, see the trends, and then be able to advise them accordingly. Also, we also know that when patients are collecting their own data, as they see the trends, they also adjust their behavior, which means that we can regulate their behavior based on the trend that they are seeing according to their health. Many people that have high sugar levels, once they see that their glucose level is high, sometimes they even skip meals to try and see if they can bring it down themselves. So these are things that digital health tools can help with, in solving these problems. I hope that also adds to the answers for your questions. Thank you.
Yeah, thank you so much. I hope that has answered the question. It was beautifully answered. So we have other questions here as well. How affordable is digital health in Nigeria? I think that is directed towards Dr. Adeolu Aruntazi.
So when you speak about affordability, it's difficult to say it is affordable or it is not affordable. Steve talked about moving our focus from, just how much will it cost to the return on investment. I know that at the moment, most digital health ventures are not as profitable as they would like to be. And many of these solutions are, sometimes being supported by governments as a social venture. But for the people that are receiving many of the cares, to many of them, it is affordable. I'll give you an example. There are solutions like Mami and things like that that is supposed to help pregnant women in the poorly, in the underserved communities in Nigeria, for example. It's supposed to help them to, remind them of their antenatal appointments, remind them to take their medications, track their progress with regards to their pregnancy and how well their babies are doing. Some of these solutions are provided to these people free. But the fact that it's free doesn't mean that doesn't cost anything. Somebody's paying for the care. And so in terms of affordability, to them, it may seem affordable. But on the other side, for Oncopadi, for example, the more urban user who is accessing the solution through a smartphone may not only be paying for subscription on that service, but may also be paying for data, may be paying for other things like that. So at the end of the day, yes, in one sense, you can say, oh, if you weigh the risk benefits approach, you may say, oh, it's affordable. But then, it's difficult to say, just say that, oh, it is affordable, it's not affordable. But the key thing is that as these solutions become more ubiquitous, as we have more access to the rural areas, I know that the cost of delivering the care will continue to spiral downwards. So you've asked also that, are there funding for support for digital health research at postgraduate level? Well, I would say yes. It depends there are entities that are providing sponsorship and support for research, but you'll have to find them. I'm not sure there are as many as we would want them to be. But one of the things that has come to the fore in recent times is the fact that we need to have more research done in digital health on the African continent. Many of our solutions are based on technologies that have been developed and systems that have been developed outside the continent, and we're trying to adapt them. But we need to begin to do a lot more research on the continent, and many people have realized this, and some people are beginning to invest in SIM. Of course, it's a resource-constrained environment, so I know that that resource cannot be available to practically everybody. But I know sometimes if you find the right people and you make the right pitch, you may be able to get some support. I hope that answers that as well.
Yeah, I'm sure it does. So we have about 2 more questions, and we won't be taking any more questions because of our time frame. So the second to the last question is, looking at the push for access of chronic care patients across several medical institutions, do you foresee a challenge in health data protection? I ask because most of the persons pushing for this type of interoperability application are data people who do not understand the nuances of healthcare practice and the error-prone points along the care spectrum. I think I will direct that to Dr. Steve, please.
No. I'll take that, because I'll take it and then I'll let Dr. Steve continue from wherever I stop. So this person has just expressed his, just apprehension about, interconnectivity and of health data. The truth is that there's no cause for alarm if we do the right things. I mentioned, for example, the Lagos State Health Information Platform. There are systems that actually allow multiple digital health solutions, EMRs, for example, to connect, and then you can create an EHR. So these systems use what we call health information exchange. And these systems are secured, and we have multiple versions of them. In one version of them, the hospital, for example, the facility that has the patient data, does not even have to give the data to the facility requiring a particular patient. Through an health information exchange, if you have unique identifications for the patient, it means that you have to implement a unique identification system. In Nigeria, as we speak, we have the national identity number that can be a unique identification number. So if a patient goes to a facility that has an EMR, all the next facility has to do is to query required data for that patient using their national identification number. And that data can be pulled through a secure system to support whatever care this new facility wants to provide. So we're not talking about a system where anybody just connects to anybody. There's going to be a well-regulated health information exchange, which is what the Lagos State SHIP is trying to implement. A system that is well-regulated with adequate security protection, where the users will be able to, there'll be user levels, of course, and information is able to be exchanged without putting patient security at risk. So I think I'll just allow Steve to continue from there. So because I actually talked about interoperability and connectivity, and I mentioned being able to connect systems. I guess that's what generated that question. So Steve, please go ahead.
Sure, just very briefly. Yeah, I think the most important thing, and going back to this policy and regulation side, we need clear policy and regulation and standards for security, and to make sure that laws are not being broken. Only the information that is supposed to be shared is being shared, and only being shared with those who have approved access. To the second point, I think about the data people pushing for interoperability instead of medical people and their lack of understanding. I think this highlights an important point, that when we talk about digital health, it takes a village. We're not just talking about technology people or data people or health people. We need we need designers, we need behavior scientists, we need a whole group of people to be able to design effective solutions, not just people coming at it from one point of view. Thank you.
Thank you very much for that beautiful response. So now we've come to the last question, which is, how can we make advocacy to the policymakers to buy into digital health, owing to the fact that we are having shortages of healthcare providers? Who would like to answer that?
Okay, so I'll speak. I'll make a point on that, and it is fact that to make policymakers, adopt digital health quickly, you have to make examples. You have to show them that these solutions can make, health outcomes better. For example, and that's some of the things that has happened in the private sector in Nigeria. Private providers have been able to demonstrate that they're a lot more efficient. They're able to provide, remote care to people that need them, and therefore demonstrate with data to government, to policymakers that these solutions are able to, make access better and make outcomes improved. During the COVID-19 pandemic, for example, many people were locked down in their homes and yet still required to access care in hospitals. Many of the private hospitals were able to use, simple solutions to remotely connect to their patients. And that showed very quickly that even though the hospitals were shut down, people could still continue to access care. And that itself began to demonstrate to governments across the world that, yes, we can still provide care and we can still be a lot more efficient with the delivery of with the delivery of care. Currently, we have a shortage of healthcare service providers. The healthcare workers in Nigeria. To demonstrate to government and policymakers, we have to show the solutions that work. We have to provide the data, and we have to show that we are still able to accomplish so much if we deploy technology. And I think, for me, that's one of the ways to provide this advocacy to policymakers. Thank you.
And I know we're short of time, so I just dropped a link into the chat, which is to the Unite for Parliamentarians, but there's a toolkit in there that's aimed at parliamentarians to trying to help make some of that business case, the arguments for investing in digital health, that I think may be useful to those who had the question. Thank you.
Oh, wow. Thank you very much. We really, really do appreciate you. What an engaging and informative session we've had today. We've explored how digital health can improve accessibility, the barriers to implementation, and policy recommendations for scaling these innovations in Africa. It is clear that Africa has incredible opportunities ahead, and we need to put strategies in place to harness these opportunities. A huge thank you to our esteemed speakers, Dr. Steve Olis, Dr. Adeolu Arugundade, and Dr. Amit Taka, for your recommendations, insights, and valuable presentation. And of course, thank you so much to our amazing audience for your active engagement and thought-provoking questions.
Thank you. Bye-bye.
All right. Thank you very much, everybody. Have a beautiful
Thank you so much. I would also like to talk about GET activities. So one of our activities are the 11th African Conference on One Health and Biosecurity. So we are trying to invite you to the upcoming 7th African Conference on One Health and Biosecurity, themed Artificial Intelligence and Biosecurity, Governance, Opportunities, and Risk for Africa. It will be taking place on the 5th to 7th of November 2025, and it will explore the role of AI in shaping Africa's biosecurity landscape. So we can find more information on www.getafricaconference.org. Also, we are currently accepting abstracts. So if you want to submit your abstract for presentation during the conference, more information can also be found on the website. The link to the website will be provided on the chat box, www.getafricaconference.org. So we also have the Get Journal of Biosecurity and One Health. It's a platform for researchers and policymakers, health professionals to contribute to Get Journal, to contribute to biosecurity One Health. And the publication is free of charge. You don't have to pay for publication. And we can find more information on www.getafricaconference.org. getjournal.org. The link to the website will also be dropped on the chat box. All registered participants who joined using their personalized link will receive a certificate of participation. Additionally, the speaker's presentations will be shared with you via the email you used to register. Kindly check your inbox after the webinar. So thank you so much. Thank you so much for your attention, for your time, for your commitment. To stay informed about upcoming events, webinars, and opportunities, kindly follow GET on all social media platforms at GET Consortium. Thank you so much for joining, and have a wonderful day. Thank you.
Thank you. Have a beautiful evening. Bye-bye.
Bye. Thank you so much.